Dr. Bebat here. I want to do our medical word of the day. And today I feel a little bit like a Debbie Downer because this one has no good outcome. And that is Creutzfeldt-Jakob syndrome or Creutzfeldt-Jakob disease. CJD is it's a brain disease, and it's caused by something called prions, which are malformed proteins that invade the brain. And what it eventually does pathologically is it eats holes in your brain, sort of like Swiss cheese. The initial symptoms are dementia. Then it starts to cause problems where it depends on what part of the brain it affects. Difficulty walking, uncoordinated movements, personality changes, visual or hearing deficits. Like I said, the mental changes. CJD is 100% fatal. Usually people, once it's diagnosed, do not survive more than a year. The good news is it's extremely rare. About 1 case per million population worldwide. Most of the time it can't be predicted. You can't run from it. 90% of them just happen. Maybe 8% are inherited. And then there's 2% that you can get from eating contaminated beef. That's called variant CJD. And you get it from beef contaminated with bovine spongiform encephalopathy. I don't know. I think the last case of that was probably in 1999 or something like that. There's only been a couple, 300 cases of that that's ever been documented. It is similar to what you hear with deer, chronic wasting disease. They're both prion diseases of the brain, but technically CWD cannot be transmitted to humans. That is always a concern because there are zoonotic problems where a disease jumps species. So, just wanted you to be aware of another terrible disease out there that most people have not heard of, and that's Creutzfeldt-Jakob disease.